Factors affecting nursing work performance of nurses in long-term care hospitals. Eun-sung Kim, Do-young Lee, Department of Nursing, Changshin University. Abstract. This study aimed to investigate interpersonal relations, psychological resilience, job satisfaction, and nursing work performance of nurses in long-term care hospitals. Their relation to analyze the effect of the factor on nursing work performance to improve the quality at long-term care hospitals. The data from nurses that have been working for more than 6 months at long-term care hospitals in G were analyzed by descriptive statistics t-test, ANOVA, Shepard's test, Pearson correlation coefficients, and multiple regression with the IBM SPSS Statistics 23.0 program. To enhance nursing work performance of nurses in long-term care hospitals, it is important to improve their ability to overcome clinical stress situations, increase job satisfaction, and enhance interpersonal skill among various members. In addition, systematic and policy support such as relevant program and work environment enhance nursing work performance of the nurses in long-term care hospitals should be provided. Keywords: work performance, interpersonal relations, psychological resilience, job satisfaction, long-term care hospital. Introduction: Korea has become an aged society with a rapidly growing elderly population, and long-term care hospital has sharply increased. As a result, it is very important to manage the quality at long-term care hospitals, and nursing work performance has been very important. This study is to improve the nursing service of nurses in hospitals and for effective management in terms of organization, check the relevance of interpersonal relations, psychological resilience, job satisfaction, and nursing work performance of nurses in long-term care hospitals, and identify the impact of nursing job performance. Nursing work performance is very important to improve overall quality of nursing, as it is the actual execution related to all activity required by a nurse in providing nursing care to patients. The purpose of this study is to present basic data in establishing plans for improving the quality of nursing care for nurses in long-term care hospitals. Materials and methods. This study improves the nursing service of long-term care hospital nurses in a situation where the hospitals are rapidly increasing as the society changes to an aging society. And for effective management in terms of organization, the relevance of interpersonal relations, psychological resilience, job satisfaction, and nursing work performance. It is a descriptive research study conducted to establish a plan to improve the quality of nurse working in long-term care hospitals by confirming and grasping the impact on nursing work performance. This descriptive study aimed to investigate interpersonal relations, psychological resilience, job satisfaction, and nursing work performance of nurses in long-term care hospitals, their relationship, and to analyze the effect of the factors on nursing work performance to improve the quality at long-term care hospitals. The study subjects were nurses that have been working for more than 6 months at 17 long-term care hospitals in G. The survey has been conducted from December 10, 2018 to February 15, 2019. The sample size was determined by using the G-Power 3192 program according to the sampling formula of Cohen. Effect size 0.15, significance level 0.05, power considering 95% 5% and 14 predictors. The number of samples required for regression analysis was 194. Taking into account the questionnaire that is incomplete and will not be collected by conducting a questionnaire for long-term care hospital nurses with many various tasks. A questionnaire was distributed to 214 people, taking into account the dropout rate of about 20%, referring to the previous study. Among the collected questionnaire, 224 copies of the questionnaire were used for analysis, excluding 4 copies of the questionnaire, indicating rejection in the consent to use personal information and 4 insufficient questionnaires. Tools and data analysis. The tool of interpersonal relations is relationship change scale developed by Guerini, translated by Moon. The instrument of psychological resilience was made by Park and Park. Job satisfaction tool was developed by Slavitt et al., translated and factor analyzed by Park and Yoon. The tool of nursing work performance was created by Go. The data were analyzed by descriptive statistics, t-test, ANOVA, Shepard's test, Pearson correlation coefficients, and multiple regression with the IBM SPSS Statistics 23.0 program. Results. Correlation among interpersonal relations, psychological resilience, job satisfaction, and nursing work performance. Table 1 shows the correlation between the nursing work performance, interpersonal relations, psychological resilience, job satisfaction. According to the correlation analysis, interpersonal relations has a statistically significant positive correlation with psychological resilience, job satisfaction, and nursing work performance. Psychological resilience has a statistically significant positive correlation with job satisfaction and nursing work performance, and job satisfaction has a statistically significant correlation with nursing work performance. Conclusion. This study is to improve the nursing service of nurses in long-term care hospitals and for effective management in terms of organization. Check the relevance of interpersonal relations, psychological resilience, job satisfaction, and nursing work performance, and identify the impact on nursing work performance. The purpose of this study is to present basic data in establishing plans for improving the quality of long-term care hospital nurses. Based on the results of this study, I would like to make the following suggestions. 1. Nursing work performance may vary depending on the characteristics of long-term care hospitals. It is suggested to repeat the study by hospital scale and region. 2. Repetitive research is suggested to identify additional factors that affect nurses in long-term care hospital work performance. 3. Develop a program to improve nursing work performance of nurses in long-term care hospitals, interpersonal relations, psychological resilience, job satisfaction, and nurse work performance, and propose an interventional study that can verify its effectiveness. Next, reference. My presentation ends here.